Hi, welcome to Healthy Living. This is Dr. Donald Pelto. This week I'm going to go over a few of the Ask Dr. Pelto questions here. Okay, so let's start by looking at some of the questions. So here is, you're probably wondering why we're looking at food. I'll talk about that a little bit. A couple of questions that some patients had about nail fungus coming back, kind of one of the COVID complications here. So let's talk a little bit about this. What to eat after a 36-hour fast. A lot of my patients are diabetics. A lot of them get injured when they're working out, and some want to know some other options. I'm a big advocate, and I talk to a lot of my patients about intermittent fasting. Lately, my plan has been not eating Tuesdays or Thursdays. So that's 24 hours plus breakfast. So everyone wants to know kind of what I eat when I break my breakfast. So here are two breakfasts. I know it seems kind of big. But on days I eat, which are at this time Monday, Wednesday, Friday. So Wednesdays and Fridays I do two meals. I do breakfast and dinner. And so usually I do like a salad base, some eggs. This is mayonnaise, hot sauce, some nuts, some cream cheese, and some bacon. Over here, you can see this is some Middle Eastern food, some hummus, lettuce salad. There's some dressings on here. This is like a hummus type of a thing and some vegetables. So this is what I break my 36-hour fast with. And so I keep kind of sharing my journey. The hardest thing about not eating basically dinner is I was doing a 24-hour fast, meaning one meal a day for a number of months, I think about a year. And now I'm doing, trying something different. The hardest thing is sleeping. So I have a couple of tips for sleeping at night. I take a shower. A hot shower tends to help me. I drink bone broth. Or just some type of a soup when my family eats dinner, just so I can keep in the same routine. That's the best benefit about eating one meal a day, is that you can be with your family and eat with your family that one meal. So if you don't eat, that's why I just drink the soup with my kids. Okay, let's go on to some podiatry. COVID toe complication. The only reason for the complication is because they didn't come in. Basically, we're not seeing our patients in the office, and they got an ingrown toenail. It had nothing to do with COVID. It's just because we've been having to push people out a few months. Toenail fungus will always come back. That was a question that someone asked this week. The issue is this patient said they had been on Lamisil a number of times and it kept on coming back. So my question, first of all, is did you have a nail sample? I really recommend doing a nail sample, taking it for 3 months. If it comes back as a fungus, the Lamisil, then waiting about 6 months, maybe doing like a booster dose during that 6-month period. And then if need be, do it again. And then I might test the nail again, because there's a lot of other reasons. It might not be coming back. So you could take a sample. It also could be biomechanical, meaning it could be the type of shoes that you're wearing that are very tight. So doing more of an anatomic fit shoe, or a shoe that's very wide in the front. Could be because you have toes that are curved down like hammer toes. So a lot of different things. It may not be fungus. If your nails are thickened, it's not always fungus. You can see this patient here, they have callus at the tip. So what this means is there's increased pressure on that area, and that could be enough to cause the nail changes. So something you should get checked out. Another patient had a question of how to kind of deal with this. Once again, another COVID patient that didn't come in for a long time. This is a fissure. This is a crack. Basically, this needs to be trimmed down, debrided, and then it needs to be offloaded. We put them in a pad. Basically, it's a felted foam pad around this area, and offload this with a special boot to help heal it. Here's how he looked from the front. This is that crack. And he'd already have some work. You can see this toe had an ulcer in the past, and we cut the tendon. And so he has a kind of a complicated foot, but he's doing better now. And then another question that a patient had is, what happens after a toenail is removed? So basically, when a toenail is removed, this is one of the videos that I did, they asked this. This patient actually had some chemotherapy and the nails got loose. I had to remove them. They do normally grow back. They normally grow back normal. There are a few things that can happen, a few concerns, like the nail can grow into the tip of the skin. It could grow back abnormal, but usually toenails just grow back in about a year. Okay, so that's a fine option. Okay, so those are the questions that I got this week. If you want to ask your own question, you go to drpelto.com, and there's a little link to, you can get there, and you can ask a question right there. Okay, hope you found this helpful. Thank you.